So you've been put on a fish oil and you may be wondering, why am I taking this? Well, there's a lot of medicinal value to fish oils. But when we talk about the medicinal components of fish oils, we are talking about two extremely important fatty acids called EPA and DHA. These are what we want you to be taking, not necessarily the fish oil. We get EPA and DHA mainly from fish or marine-based products, but we can also get it from algae. EPA and DHA is also higher in meat from wild game and from grass-fed cattle and chicken. Omega-3s are a family that make up the EPA and DHA. But there's also linoleic acid, and that comes from green vegetables, olive oil, flax, chia, and hemp. Now these can be converted into EPA and DHA, but it takes a little time. Overall, our diets have way too much omega-6s and way too little fish oil and EPA and DHA. So we need to obtain them from our diet. The typical diet contains lots of processed food, things that are high in corn, grains, flour, and those are really abundant in the omega-6s. Our cattle that we get also are fed corn-based products a lot of the time, or grains and flour-based products, and they can have a high level of omega-6 in them as well. We pack these oils within our cells, and when there is damage, we get either inflammation or a decrease in inflammation. So in this side, you can see this is the typical American and Canadian diet. We typically have a ratio of omega-6s 10 to 1 omega-3. This is a pro-inflammatory state in our tissues. Whenever there is damage, you're going to get an abundance of pro-inflammatory mediators, which is basically inflammation. When we incorporate lots of EPA and DHA into our diet, we then can shift over a period of 6 months to a year, we can shift our tissues to a healthier ratio of 3 to 1. Now we need a little bit of omega-6s because we need to feel pain when we have damage to our tissues, but only when there's actually severe damage. So in this side, you would feel lots of pain and inflammation just with walking. It may be diffuse, you may just have it always. But on this side, you will only feel pain when you have pretty extreme damage done to your tissues. And that's because we have a ton of omega-3s. And when there's damage, we release both the omega-3s and the omega-6s, and the omega-3s are anti-inflammatory. They take care of the inflammation. We can also use anti-inflammatory herbs to decrease inflammation. So there's lots of tricks in the short term to get you some pain relief. And these are things like ginger, turmeric, flavonoids, and boswellia. And even magnesium can have an anti-inflammatory effect.